Normal body temperature has a range, somewhere between 36 and 37. A lot of people will say normal body temperature is 37.4, but in fact it will vary at different times of the day, and certainly it varies in age groups, so that a baby's temperature is slightly higher than that of a toddler, and again an adult's temperature will change as well. And it largely depends on the ambient temperature of the room in which somebody is in. It depends on what they're doing, whether they've been running about, very active, depends on what they're wearing, depends on whether they've had a meal. So the best way to find out what's the normal range for yourself or your children is to measure their temperature several times at different times of the day over several days, so that you get an idea of what's normal for them. And then when they're ill, you're not only confident about taking their temperature when it's a crisis, but you'll know what to compare the temperature to, compare it to normal, and interpret it correctly. The temperature will change depending on where you're measuring it from. So it'll be different on the forehead, for example, to in the armpit, to if you take the temperature through the oral route, or if you take an ear temperature. And the reason for that is there are so many variables if you take skin temperature. Even if you take an oral temperature reading, if the mouth isn't completely closed and if you haven't left the thermometer in there for a minute or so, you might get a reading which is lower than the core temperature. The most accurate readings are from the eardrum using an ear thermometer or a rectal thermometer, which tends to be done mainly in hospitals. And in the same age group you'll get different readings, not vastly different within the normal range, but within 0.2 or 3 of a degree Celsius. So it's important to realise that small differences are not that important, they're quite normal. If we look on the chart here, you can see what the ranges are in different age groups, and there will be a variation between children of the same age group. So as long as you're aware of that, then it helps you to interpret what is normal and what is abnormal. I think a really good method of becoming truly confident when you're taking somebody's temperature is to become familiar with a good, reliable thermometer which you keep in the home, and test people when they're well, so that you take readings, say 3 times a day at different times of the day for several days, so you can assess and be confident about what's normal for them. Then, when a crisis happens and somebody's burning up with a fever, you can see exactly what to do and how the result compares to what's normal for that person. And then I think you can confidently say when you call the doctor or speak to the pharmacist, my child, my toddler, my brother, sister, whoever it is, has a temperature of this amount, which is completely different to what it normally is. When a temperature is elevated above the normal range for that person, it's important to assess that temperature in the context of how they look and what other signs and symptoms they're exhibiting. So if a child is running around, eating normally, playing, happy, smiling, engaging with you visually, and there's a slight temperature, it's probably nothing to worry about too much. But if they're very floppy, if they're off food, if they're exhibiting signs of a rash, or they're just not engaging with you, then the temperature is much more significant. If a temperature reaches, say, 39 degrees, 40 degrees, and there are signs and symptoms which suggest the child is ill and suffering, then clearly that's the time to get professional help and talk to somebody who can help you and guide you.